And you can hear me okay and everything?
I can.
Good.
Hello, I'm Dr. Ruth Roberts, your pet's ally. And with me today is Michael James Daly. And I have known Michael
Everything. I
for,
can.
for a lot
Hello,
of
I'm
years.
Dr.
And bear
Ruth
with me a
Roberts. You're
second to get the technology squared away. There we go. So I've known Michael for a lot of years and have worked with him in my bricks and mortar practice. And Mike did something special quite a number of years ago. In 2011, shortly after we met, he went through and became a certified canine massage therapist. And then last year, he became a certified equine shiatsu massage practitioner. And so he's been working on dogs, cats, and horses, dealing with a variety of issues, and working with agility dogs. So Mike is now a bi-coastal massage therapist. He lives in LA most of the time and is also in Charleston, South Carolina. Goes back there once a month to take care of his existing clients. And he's just a wealth of knowledge and has helped so many uh, people with their agility pets and with older pets. And that's part of what was such a big help for Mona sitting here, who's not quite sure about all of this. So, Mike, thank you for coming on. We're having some technical difficulties, as you can see by the nice green telephone, but I think the audio is at least working. So, welcome. Great to have
Oh,
you.
oh yeah, so glad to join you. Absolutely.
Well, golly. So tell me, I mean, you and I have talked about this quite a bit, but tell the folks that are watching kind of why you got into this and why you find it so important for older pets and for athletes as well.
Well, I originally got into it just, I was a veterinarian technician for 20 years and was always told whenever I was restraining an animal or holding them that I had a really good way with calming them down. So um, when I asked you about it, you had mentioned that canine massage was a thing. And just growing up, I had a German Shepherd, and she lived to be about 17 years old. And I watched her, suffer from arthritis and go through the discomfort and pain from it. So I really wanted to, you know, take this certification and apply it and see, the difference if it could make a difference. And I mean, it was amazing. I remember when I worked on my very first dog, I was, just starting and, during doing some of my case studies, and I literally like had the book next to me for the anatomy and like going like, what do I do? Where is this? And doing this dog, and this was a dog that had difficulty jumping, um, just jumping up on its hind legs when it was excited. And just after 10 minutes of that, with me not even really knowing anything, but just applying what I saw from the book, this dog was running around and jumping and so happy and amazing. So I saw what it could do to help decrease all that inflammation with arthritis and make dogs happy because they love to run, jump, and play. That's what their life is. And so, that's what massage can do is, bring life back to a dog almost.
And certainly for Mona, so she's 15, and when we were still in Charleston together, you were doing some work on her on a regular basis. That
Hmm.
helped tremendously because she does
Oh
have
yeah.
neck injuries. So she every morning she gets a little mini massage, but that's what I was talking about last week. If we don't keep the mobility going, if we don't keep the blood flow in the fascia and the tissue, the arthritis is never going to go away on the X-ray. But
Hmm.
we can influence how much pain and discomfort these guys experience by helping them stay mobile. So the x-rays may look awful, but if we keep the mobility going, so they feel so much better and they can do more normal, have a much more normal life.
Absolutely. And the two strokes that I want to talk about have a lot to do with that fascia because that fascia is a really important part of the body. It's all that loose skin that you find around your dog, and it's filled, with blood vessels, with nerves, with lymphatics. It stores fat. So, you know, what happens, and it's a kind of dramatic term, but I always like to use it. And Dr. Roberts has heard me use it before, but I call it the circular path of destruction. And, so when a muscle tightens, that fascia tightens, and when that fascia tightens, the muscle tightens more. And when the muscle tightens, and the joints tighten, and when the joints tighten, the muscles tighten, and it's this whole circular path of destruction. And so, just keeping that fascia loose is going to help, prevent that muscle tightening from more, helping that joint from not tightening. So just working on the fascia alone can be extremely beneficial for a dog.
Amen. And Mona's getting impatient, so let's talk about and this will be, so she's like, you can tell I'm hanging on to her. You can't see this, but everybody else can. She's like, I want down now.
I know, Mona.
Yes. So let's talk a little bit about the first stroke, the effleurage.
Mm-hmm. Yes. So effleurage is basically, so effleur means skimming the skin and stroking lightly. So an effleurage is basically petting your dog, but I'm going to give you more of a motivation behind that, so you're actually doing something. And so what you're going to do is just going to take, what I'm showing you are, and what I was thinking about this is, what can I show and talk about that people will actually do in the morning? Because, I don't know about you, but like in the morning, like, I want to get up, have a cup of coffee, do my meditation, do a journaling, I maybe do that 5% of the time. So these exercises you can literally do laying in bed next to your dog.
And that's where Mona gets most of her attention. She gets up, she comes over to Mary Jo and I, and she's like, okay, who's doing the massage today?
Right. Good. So for effleurages, you're just going to basically, take your one hand, start at the top of the head, and just gently rub all the way down to the rear. And then take your other hand and do the same thing. And the key with the stroke is that you always want to remain contact with the dog. You're always keeping that flow going. And then you could slowly move to the side of your pet and underneath, keeping the constant contact going. And with each stroke, you're just going to apply more pressure and increase the speed. And what this is going to do is it's going to just help increase the circulatory system and get things flowing and help those muscles warm up initially. Because, like us, and I always tell clients this, especially with older pets, and a lot of my clients have pets that are 8 or above, we're looking at it's almost like people being 56 or above. And, for me, if I'm asleep, I'm sleeping all night and these muscles aren't working, it takes me a little time to get up out of bed. So it's going to be really beneficial to get these muscles that haven't been used overnight to kind of get the circulatory system going, the blood flow going, to get them warmed up and ready for use.
Yeah, and so what you can't see, Mike, I'm doing that stroke, the effleurages, and so Mona finally relaxed and is like, okay, I'll sit here for a while longer.
Yeah. She's like, oh, okay.
On the side, she's like leaning into me, and so she's kind of around on my lap and telling me what she'd like to work on a little bit more. And right side evidently is a bit sore for her.
Excellent. Yeah, and that's really key. So it's always key to really watch your dog, because they will tell you. And also along with this being beneficial to help warm up the muscles, it's also just a good bonding exercise to have a good moment with your dog, say, oh, good morning, and all that kind of stuff.
Exactly. And that's another one of those things we've been talking about quite a bit. We worry about our pets, but what we don't do is take time to just sit and be present with them. And that's really what is most helpful to them.
Mm-hmm. Absolutely.
Cool. So, and then the second stroke, and I'm sorry, I can't remember the name, but basically it's a vibration kind of thing.
That's exactly what it's called.
So we got 3 fingers to either side of the neck, and basically I'm just kind of doing that, and you can see she kind of likes this a lot. She likes it a lot.
Exactly.
But she's standing up to help me get in there a little bit more. So we'll go ahead and talk about that a little. Yeah.
So you're going to take the 3 fingers, and as Dr. Roberts doing is you're just doing a trembling motion. And what's great about this stroke, and I usually tell a lot of clients about it, is because you don't have to have really a knowledge of anatomy of a dog to work this stroke. You can, I just tell clients to work the neck, work the back, work the chest, work the hips, and you're going to do a great deal of beneficial releasing on the fascia area and the muscles with the stroke. I've worked on dogs that have really bad arthritis, have knots and tension all over, and I'm doing every stroke I can think of. I'm doing cross fibers, I'm doing circular friction, I'm doing shiatsu, I'm doing stretching, and not getting that knot to release. And then I'll end up doing just some simple vibrations and it will release in a couple seconds. So it's a really, really beneficial exercise. And dogs always, this is usually the first stroke I do when I meet a dog because they love it so much. So if you ever want to impress somebody, you can just start these vibrations and their dog will just fall right over because they love it.
And Michael truly is the dog and cat whisperer in the practice. It was just stunning. We have this cat that was freaking out and being like, oh no, we are not doing that today. And Michael would start doing his little thing. And all of a sudden the cat would be like, fine, okay, get it over with. It was awesome.
Oh, I love those cats.
Yeah. They're like, oh God, whatever. Yeah, so Mama's definitely chilled out. She's grooving on this, especially the vibration one on her rear.
Yeah, she loves vibrations.
Yeah. And so the other thing that's interesting too is that right along the back where I'm kind of, and sorry, let me see if I can turn her towards the side a little bit so you can see what I'm talking about. So here's the top of her spine, and then parallel to the spine is the bladder channel. And in traditional Chinese veterinary medicine, that the bladder channel contains command points for almost everything in the body. So in doing these movements every day, you're not only releasing the fascia, but you're stimulating the entire bladder channel, which is only going to help everything get happy. And sort of one of the other things too is that this peak in the back, right at the end of the rib cage, which is where my thumb is, that is the associate point for the kidneys. And in Chinese medicine, the kidneys control the rear end, the bones, the joints, and they contain your jing or essence. So working on those points, and often in older pets, you'll feel a little divot, especially in this area, and they'll tell you if it feels good or doesn't. That can be extremely beneficial to kind of get the whole system engaged. So, Michael, I know you do a ton of work with agility dogs. What are, and that's something we may come back and revisit one day, is kind of a good warm up for exercise, because even if your pet's not an agility dog, but you're going to go out and throw the ball for it, that's where cruciate ruptures happen. That's where dogs do all sorts of crazy stuff and damage the soft tissue. So talk a little bit about that, if you would, kind of what the importance of a warm-up is, even if you just do these simple movements prior to the exercise.
Yeah, absolutely. I mean, it's important, kind of what I said before, is that, these muscles, when they're sitting for a long time, all the blood flow is going out of them. So if you're just, if you have a dog, especially in agility, what'll happen a lot of times is they'll have their dog in a crate sitting in the car. And then when it's their time to run the course, they'll just jump them right out of the car and go right to the course. And their muscles have not gotten a chance to really warm up. And like I said, get that blood flow going into the muscles so that it helps warm that up and warm up the joints. So a lot of cruciate tears and things like that do happen because of the rushing from just laying down to no warm-ups to running the course.
Yeah, and that's a big thing. So even if you do something simple on our website in the free membership area, there are two videos. One is a Tuina, which is a form of body work that's in traditional Chinese veterinary medicine, and then also passive range of motion videos on how to move each of the joints. So is that something you get your clients to do on a regular basis, or?
I do. So my goal is always, just because I know how I am with things in life, is that if it's the easiest thing, I'm going to be more likely to do. So I tend to try to focus more on active range of motion exercises, which passive, it's you're doing the exercise. So you're holding the leg and stretching the leg, while active range of motion exercises is when the dog is doing the exercise. So, so part of that warm up, in the morning that everybody can do, because this is stuff that you can do while you're, getting coffee or, getting dressed, is just basically sit and stand. It's a really simple exercise.
And sorry, I can't get Mona to demonstrate that because she only she's a treat piranha, and she'll launch forward and grab it out of my fingers. But essentially, what you would do if you had a pet that's more cooperative is you'd have the treat up above its nose, and they're standing, sit, stand, sit, stand, and do that about 5 times. Is that what you said?
Yeah, I would say about 5 times. And it's just basically what you're doing is you're just opening it. It's just like us doing squats. So you're just opening up those hips, you're loosening up those joints, you're getting the blood flow and warming up those joints so that you have better range of motion when they're going outside.
Great. And then the other one you were mentioning too, again for flexibility, is again using the treat. So the dog's sort of looking at the treat, and the goal is to get them to turn around and kind of look at the hip following the treat.
Yeah.
So that's going to open up all sorts of stuff along the spine and in the hips and the pelvis.
Absolutely, yeah. It's if you literally do it to yourself, I mean, you can feel the stretch through the neck, through the shoulders, into your lats, along the longissimus muscle, along the spine, and your hips.
Yeah, and it's awesome. Well, anything else you want to share with folks? There's a couple before we get down to. There's a few questions for you, and Jenna says hi, by the way.
Hi. Yeah, I mean, really, the thing to keep in mind with all these exercises is definitely, when I say 5 times, and you always want to keep in mind your dog's age, your dog's ability in that moment. So some dogs, they have a difficult time sitting and standing. So, always make sure to watch your dog. Always make sure to see what they're able to do and what they can do. I mean, if you can have your dog that's an older dog, just do, 1 or 2 sit and stands and maybe 1 stretch on each side. And that's all they feel like they can do. And that's all the time you have to do. That's better than nothing. It's still going to make a huge difference.
Yeah. And that's awesome advice. I mean, we start out with this program for ourselves, right? And we do this crazy thing for 30 minutes straight. And then the next day we can't move. Same thing with these guys, especially if they're older. Okay, we're going to do 5 of these and 5 of these and 5 of these. And then the next day they're like, oh, wow, that hurt.
Exactly.
Or they can't do them. And so the other thing with these, the gentle moves, even the effleurages and the vibrations, if you hit a spot and all of a sudden your dog is swinging its head around looking at you, that's telling you that hurts and you need to ease up a little bit and back off. So that's helpful too. So I think Karen had a question about her senior rescue with really stiff back legs. And so Karen, I think Michael probably answered that for you. And looks like that's all the questions we've got thus far. Anybody have any other specific questions for their pets? And Aaron, you're in LA, so I'm going to put Michael's Facebook page down below, but you ought to hook up with him. I think you guys are birds of a feather. Aaron,
absolutely.
Yeah, Aaron's got, and I think Aaron, if I'm remembering right, my brain doesn't always work right, but you've also worked as a veterinary technician, so you can share the woes of the profession as well as the beauty. It's all good stuff. Great. And Sherry, you're very welcome. We're glad to be able to show you how to do this. Is this something y'all would be interested in if Mike and I can do a Zoom meeting and do a sort of a master class of things you could do at home to help your pets out? And actually that way you could interact and say, okay, my dog's got this stuff going on, and actually this works for cats too. So, they're funny how they react to it, but when they love it, they love it.
Absolutely. Sorry to interrupt.
Yeah, tell the cat.
I had a cat. I've worked on a couple of cats with massage, which people always look at me funny, but they really, once they realize what you're doing, animals are really smart, and once they realize what you're doing, they get it, and it makes a world of a difference. Even for cats, this cat had a stroke, and the massage increases cat's mobility, and it was able to live a lot more comfortable life until eventually we had to euthanize it.
Yeah, and that's the key thing, you know, if we can help them feel better along the way till we get to the point, then golly, whatever we can do, that's awesome stuff.
Mhm.
So sounds like all of y'all would love to have a master class. So I'll talk with Mike, find out when we've got some more. He's got some more time available, and we'll set that up. It'll be something we'll probably spend 30 minutes or so showing you some basic stuff, and then do some Q&A and get you some more specific answers for your pets. And wow, and it just started snowing here.
Oh,
Surprise
wow.
in Santa Fe. Yeah, especially the rear end weakness, because I think, Sherry, you'll find that doing this on a regular basis, even just doing the basic stuff we covered today, you're going to see a big
Ab-
improvement.
Absolutely.
Yeah, cool. Sorry. So we'll Mike and I will talk and get a time nailed down, and then we'll get you some information on the class. It'll be something that it'll be a paid class, but it'll be a relatively nominal fee. But I think and you will have access to the recordings of it. But I think that's the thing, is that you'll get so much value out of this and be able to use it so efficiently with your guys at home. So I think that's what we've got for you this week. You know, I talked a little bit about last week about making sure you're doing the basic stuff, feeding an anti-inflammatory diet, using supplements to help prevent inflammation, and then increasing doses of the anti-inflammatory supplements as your pets age. So things like fish oil, joint supplements, and things like that. And then the other thing I'd really encourage you to do is to make a goal to move with your pet on a daily basis. And, and even if it's 2 minutes, in fact, there was a study on the human side that came out this week that said, even if you exercise 5 to 10 minutes a day, your lifespan increases dramatically. So that applies to our pets as well. So even if it's 2 minutes and your pet's been a couch potato, go for it. But that's the awesome stuff. And then the other thing I'll mention too is that if you don't already own a copy of the original Crock-Pot diet, as soon as I get into Shopify and set up the sale, we're going to have an additional discount on both the Crock-Pot starter kit, which includes a copy of the Crock-Pot diet and the private Crock-Pot chef's membership access, as well as some fish oil. We'll have a 5% discount, which will give you a massive discount on that kit, plus a 5% discount on the fish oil that I've been using for years. And what's awesome about it is that the omega-3 fatty acid dose is very high. So for an average 50-pound dog that's really painful, we want to get them about 2,800 milligrams of omega-3 fatty acids per day. So you can do that with that product in 1 teaspoon of the fish oil. So I'll get that set up for you. So that'll be going through the 28th, and we'll have a special surprise next week about things we're featuring in the store. So wonderful to see everybody. Thank you, Mike, so much for jumping in and helping us out, and good luck today. And I will see you all next week. And until then, remember, your pet's best health starts in the bowl. Take good care. I'm Dr. Ruth Roberts, your pet's ally.